Hey everybody, so we're going to cover how to prep for administration Cefazolin or Ancef. Cefazolin comes in a powderous form that will require reconstitution. Each vial contains 1 gram of medication. So we'll use a 10 ml flush to do the reconstitution. So just begin by popping the top using sterile technique. We'll get our alcohol prep and just scrub the cap. So when you use that 10 ml flush to reconstitute, you'll generally only need to inject approximately 3-ish mLs. So you can do a couple different things. You can inject the fluid, you can shake the vial all about, just kind of stirring it up, or you can push and pull the plunger, just kind of as a suction technique to flush in and out of the vial. So then once you've shaken or you've plunged it around and you have all of the medication reconstituted, then you can look in the vial and you do not see any powder. It's just one consistent clear substance. Then you can draw it all up into the syringe. Once it's all in the syringe and you've displaced all the air, you will actually notice that now that your 10 mLs would be a little bit overfilled, just slightly over 10 mLs. So what we're looking at here is 1 gram in 10 mLs of saline, or 100 milligrams per ml. You may use the same syringe to reconstitute additional vials. Just note that that will change the overall concentration within that syringe. So reconstituting 2 or 3 grams is going to be typical for adults, whereas for pediatric, that's going to be up to a max of 2 grams. Cefazolin requires a slow administration. We want to administer it slow so that we can check for any type of allergic reaction or potential anaphylaxis. So giving it over that minimum of 3 to 5 minutes is ideal, rather than slamming it and then inducing sudden anaphylaxis. While allergic reactions to cefazolin are rare, they can still occur. So it's better to find these subtle symptoms with a slow administration rather than a rapid push. So rather than diluting that up and mixing in a 10 ml syringe to push that super slow over 5 minutes, it's going to just be easier to inject that into a 100 ml bag and let that slowly infuse over that at least 3 to 5 minutes. So with that adult dose, we're going to do 2 to 3 grams. So under 120 kilos, they get 2 grams. Over 120 kilos, they get 3 grams. You may reconstitute those 2 or 3 vials into a single 10 ml flush. For pediatric dosing, it is weight specific. So that would be 30 milligrams per kilogram up to 2 grams max. So there's basically 2 prep options we have here. So if the dose is over 1 gram, that's going to be more than a single vial. This is where those 2 options are going to come into play. Okay, so if we reconstitute everything into 1 vial at a time, that's going to give us that 100 milligrams per ml. So we could easily do that if it's easier to keep that math of measuring out that way. So if we needed more than 1 vial, we could reconstitute all up in 1 flush, inject that in that 100 ml bag. And then we could do the same thing again and say that, they ended up needing 1,500 milligrams or 1.5 grams. So you could give that 1 full gram, and then you could give that other 500 milligrams by giving that 5 mLs out of that second syringe. Okay. Or if you need to reconstitute 2 vials, that would be for the patient that's over 30 kilos, because over 30 kilos is going to get you roughly more than a gram. So you can reconstitute both vials in that same 10 ml flush, and that would give you 200 milligrams per ml. So we'll take our cefazolin and inject it into the bag. So the coloring was just added here just simply for effects. Whenever you prep it, it will not turn blue. So we've injected the medication, we give it a little shake up, and then we'll just adjust our flow to try and titrate this over 3 to 5 minutes. Okay, so this video is sped up a little bit, but running a 100 ml bag wide open with a 20 gauge catheter is going to take about 1.5 minutes. So if we just take a 100 ml bag and we're running it at about half its wide open flow, it's gonna roughly get you there. So the goal is to infuse this slowly. So if you really did the math, it comes out to a little over 200 drops a minute. I know we can't calculate that out, but just time and kind of average out that we're infusing this slow. Slow is the goal.